I'm Dr. Leanne Brady, and what I want to do is talk a little bit about Luxaflow Ultra. And Luxaflow Ultra is a really phenomenal flowable material from DMG America, and it's a companion product for their Luxatemp Bisacryl provisional materials. It's almost inevitable, no matter how well we try to manage insertion of the tip on the Bisacryl cartridge and managing the injection of the material, that we will get voids and air bubbles. In addition to repairing voids and air bubbles, really common for me that I want to make additive changes to my provisionals at a patient-approved provisionals appointment. So I want to increase the length of their provisionals, or I want to increase the facial prominence of the provisionals, and I need to add material. And one of the challenges we've all faced as we've done this is that when you're trying to add a flowable material to a provisional bisacryl, you can see the repair or the additions because the flowable doesn't match the aesthetic properties exactly of the material. So one of the things that I love about the Luxatemp family of bisacryl provisional materials is the companion Luxaflow Ultra. What you're going to get is you're going to get a flowable material that's been designed to mirror the exact aesthetic properties of your Luxatemp. So when you go in and you repair those little voids or air bubbles, you're not going to see where you've done it. If you want to add to incisal edge length or thicken the facial of your provisionals, you're not going to be able to tell the difference aesthetically between the flowable material and the original bisacryl material. The other thing that I love about this is it really has pretty perfect handling properties for what we use it for, which is repairs and add-on for our bisacryl. So we want a flowable material that's pretty low viscosity that'll go in those little air bubbles, but we also don't want it to just be runny and go everywhere. So this material has a really nice low viscosity but non-slumping formula that works very, very well for the usage of repairing what we're doing. It does have some radio opacity so we can see it if we're going to take x-rays of our provisionals, or we're going to use it underneath to even reline so that we get really great marginal fit so that we can make sure everything is working well. So if you are going to repair a provisional, first thing that I do when we take the provisional out of the matrix is I examine the provisional and I look for those little air bubbles. I put my loops on, see, do I have any voids, air bubbles, anything I need to repair? Because the perfect time to do it is right then before you remove that air inhibited layer. At that point, you aren't going to have to add any kind of dent adhesive to bond the materials together. That air inhibited layer will actually act like the bonded interface. And go ahead and do your repairs and then light cure them, and then you can wipe off the remaining air inhibited layer. So if you've not tried Luxaflow Ultra as a companion to your Luxatemp provisional materials, I really highly recommend it.